A very warm welcome, Inas. This is your first time at any of our events, and our inaugural, it's the first time for us also, the Internet Commerce Summit, so it's special for us. Thank you for joining.
Thank you for having me. Thank you.
And we're going to be discussing a rather serious topic today. I'd like to start with some data. Globally, 1 in 8 individuals suffer from some form of mental disorder. Unsurprisingly, that is why the World Health Organization has been calling mental health a growing crisis. It's not much different in our region. Am I right in assuming so?
This is so true. I mean, this is the crisis that we're living in nowadays. And unfortunately, masks and sanitization cannot really do much of it. Globally, the number is correct. Here in the region. Yes, please. Yes, sure.
Ladies and gentlemen, I have a kind request. May I humbly ask you all to please sit down? Thank you so much.
Yes, so the numbers here in the region, we're talking about 1 out of 4 people is facing a kind of depression and or anxiety. And these numbers actually are pre-COVID.
Yeah.
Post-COVID, the situation got way more alarming, as 1 out of 3 people who survived COVID would face a kind of depression or anxiety. So as you've mentioned it right, and has been declared by WHO and the UN, mental health crisis is something that we really need to be prepared more for it and invest in a way that to minimize, its risks on our communities.
Absolutely. Yet there still is so much stigma around any discussions on mental health, so much so that even as burnout and anxiety and depression are at an all-time high, individuals feel some sort of hesitance to recognize it themselves, even as they are struggling, leave aside talking about it openly. However, impact-oriented businesses like Takalam, they're making a huge difference in helping people open up and in a manner that is discreet still. And on that note, I jump on to Takalam, which actually translates to talking in English.
Yes, it's the Arabic word for talk. Yeah.
Yeah.
Thank you for mentioning this. I mean, Khawla Hamad, my friend and the founder and CEO of Takalam, and I, we have been on a mission to really ease the access to well-being services for our communities in the region and even globally. And we've tackled this in a way that it is inviting for people to come in, to help them overcome the stigma and the challenges that you have mentioned. Takalam has been designed and developed to our community members in a format that it is more of their friend or companion when it comes to mental well-being. So as you go to the gym to take care of your physical health, Takalam solutions are available for you to take care of your own overall well-being and mental health. So we designed it in that way. Users, they can join us anonymously. We believe that Takalam is a safe space for everyone to start their mental health and well-being journey.
Absolutely. Can we take a step back at this point and understand how and why did the platform come about, and how has it evolved over the past few years in terms of features, in terms of funding, as well as your geographical reach?
Thank you again, because I love it when people take us back to the beginning of the journey,
That's
right?
always
Time flies.
Yeah.
And it all started with a discussion that Khawla and I were having about, the importance of mental well-being. We've been going through our own challenges. For me, it was the grief after my dad passing away has not been easy for me to deal with and cope with. So it was more of a trying different solutions that they are even available globally. But it didn't speak to us. didn't speak to our not only language, our culture, our needs here in the region, the rhyme of our needs, and of the way that our days are going, and so it has to be more of a customized solution that matches our community's needs and understanding. So we were like, just let's try and do it. And it's been a great journey for both of us, very rewarding, despite the challenges, of course, that comes with it. We're developing a technology, so it's beyond having Takalam as only a marketplace that provide access to therapists or counselors. We are developing technology and features that will make this journey and this communication more effective and efficient. So we continue to build up on it on a daily basis. Being in UAE and starting this from here, targeting as well the Saudi market, has been really of a great, I think the best ecosystem for startups to start and rise from here. Great support, leadership in both countries and in the region puts mental health as a priority to increase the livability index in the kingdom. Here it's been always on the agenda, the national agenda, and we're proud that Takalam contributes towards the solutions of this.
Would you like to talk a little bit about the features and your funding journey, importantly?
We are now actually on our seed round, which is our second funding round. It's been really great. We just launched it, and we're in discussions with many investors that they believe that there is an opportunity, business opportunity, and at the same time, make a positive impact in the community. So we're in these discussions. The features at Takalam, besides giving access to certified and licensed and carefully selected counselors, the users, they have access to digital tools like mood tracking, journaling, meditation content, besides some content in recommendations books and blogs. Yeah. And for our community members, as we've mentioned, this is new for them. So just to give them the access to a group of therapists or counselors, it might be of a challenge as well. So we help them and we guide them through that process with a matching feature, where the system would suggest for them the best match of counselors or therapists that they can start their journey with. Our mobile application is called Takalam, and it's available at all app stores. I would really invite whoever is listening and tuning in to download the app, thank you, and try the application. And here is very important to mention that we, as we have and we make our application available for the community members directly, also for businesses, which is really important, the application is available for them. So we have an interface and a special solution and access for employers, even government entities. They have chosen Takalam to make our services available for their employees. So all of that is available, and we have a solution for the employers, where is an annual subscription per employee.
So you've seen a vast difference from the time the digital platform launched, with the uptake of and interest, importantly, from both private and public sectors. Can you tell me a little bit about the funding journey itself? Because this wonderful platform is set up by yourself and Kola. And we always hear that there's certain kind of bias when it comes to the investor community. Have you ever faced that?
When I believe here you're referring to the gender bias, right?
Yes.
No, I mean, we're really proud of being a female-led startup. And on the contradictory of this, actually, we have been receiving access to special programs and funds that are meant to support female women. So female led startups. So we have been receiving that kind of support. Speaking to investors and to VCs, we have not felt that kind of, discrimination, to be honest. We have been always given the chance. We have oversubscribed in our first funding round. Wow. And I believe this one is on the right track as well.
That is really wonderful to know.
Thank you. Yeah, it is. It is actually promising. The ecosystem, and I believe it has been already formed, and it was structured in a way to build on the talent and on the opportunity rather than of a gender over the other or so. So we're capitalizing on it, and Takalam with our offering, I believe we have been of a great traction. Built also great records for investors to believe in us and give us that, their trust to continue easing the access for our communities to mental health services.
Certainly, and we've seen a general uptick in investments into digital health platforms since the pandemic. There has been a sharp increase in investments.
Well, till fintech kicks in, I feel like it's sometimes more fun for them. Well, definitely the pandemic, and if COVID did anything good, it's actually raising the awareness about how much of healthcare services can be offered and delivered online, including the mental health. Mental health now, it's as we've started this discussion, it is of a crisis that it's attracting attention of leaders, business decision makers as well. So COVID definitely, and the pandemic helped in raising the awareness for how much of healthcare services can be offered online. And also looking into things not only on the treatment aspect, but also preventive care is very important. And that's what Takalam, we really cater for that. Again, you're going to the gym, taking care of your physical health, Takalam for your taking care of your mental health and well-being. So a lot of care can be done in terms of preventative care can be done online, where it is more convenient, easy. You can access it at any time from anywhere, and and that's the beauty of technology.
Sure, and continuing the discussion on that point, how are platforms like Takalam using artificial intelligence and the data that you have access to, incredible amount of data, to sort of use it for preventive care as well as handle the amount of inquiries that you get through your platforms?
Well, ChatGPT and its magic is even scary, right? I mean, there's great resources. Technology continues to be, again, enabler. There's no limit to how much technology can help into this. When it comes to mental health and well-being services, the human factor is also very important.
Crucial.
Right?
Yes.
It is really crucial. However, the utilization of technology can help in making it more scalable, making it again easier, and with the way we are building our systems is in a way that we overcome the challenges. For example, the symptoms overlapping when it comes to mental health. So the screening diagnoses are a bit tricky as well. So technology, again, as a computer science graduate and a big fan of how much technology can really affect our life, definitely we continue to build on resources that are available for everyone, and we have our team of great minds who are determined and committed to utilize the technology in a way that create the most positive impact for our communities.
Have you faced any tech barriers on your journey? Because you're also dealing with very, very sensitive data.
Well, it's not of a barrier, but it is more of something that we need to ensure that it is well protected, which is the data, of course, where the data resides, how it's been collected, how it's been treated, and so on. That's something that we are continuously looking into enhancing it and improving it. Yet, as of at Takalam, we don't actually save any sessions or record any of the sessions, the counseling sessions that happens at our platform. However, still, this data and the users, as I've mentioned, as they join us, they can be anonymous. So they just use, whatever email address you would like, and you can sign up using your email address and jump into the call with your counselor. So there is a lot of, in terms of levels of protection that we have established throughout the user journey to protect the users, privacy. This is really important, especially if you want to encourage our community members to overcome the stigma.
Absolutely. And talking about stigma, Inas, do you see digital-led platforms like Takalam actually facilitating and destigmatizing conversations around mental health? pivotal to note is also that there's a certain amount of this dearth of medical healthcare experts, mental health care experts at this point globally. So where does these technology platforms figure in when we talk about mental health? How are you facilitating conversation, destigmatizing conversations?
Sorry, so you're referring to the conversations of...
Yes, and how can digital technology platforms destigmatize conversations, facilitate people to open up?
Yeah, because again, you can join and start your journey at your own convenience, from, at your own safe space, at your own time, and without even declaring your ID, right? That's how Takalam has been designed, where we tap into the area which is pre-treatment, or to be along with the treatment as of the therapy and counseling, whereas no medication is required. Of course, if a medication is required and medical prescription is required, more data will need to be, collected, and it has to be definitely as per the HIPAA compliance and so on. We try to follow the compliance at all levels, data protection also protocols, that is there. And for the user, especially for our community members, the more you make it really simple and easy, it helps them to start. And we have developed also other features to make this communication more effective. So people, they would come in and they start using the application for journaling, for example, or mood tracking, because that has been scientifically proved that it has a great impact into the therapy effectiveness and so on.
Sure.
So the user, they start to put in and come in for this, and then as they have their session, they can refer to that. So creating content as well to raise awareness and put it, make it available for our community members in an easy and simple format also helps them and encourage them to start, the communication. And I have to thank you again for this event and others that we continue to attend and be close to our community members to raise the awareness and encourage them to, try our services as employers and, of course, as individuals.
Surely, and your platform is actually built with that context in mind, that you want to reach out to people who are from the same cultural backgrounds. However, what kind of reforms, research, and awareness do you think are required to actually have those genuine, open, honest conversations?
I'll tell you, the leadership of, in our region, and talking specifically about UAE and then Saudi Arabia, did state this as a priority, right? So that's from the government level. Now, for the employers, we've been really proud to see that employers have been contacting us at Takalam to offer our services for their employees. So having the decision makers in the businesses taking, looking at this seriously and embedding it in a way that it is part of the workplace culture and environment is important. And here I have to mention as well that for each $1 spent and invested in mental health at the workplace, the ROI is $4 minimum. So the return of investment is clear. And that's all what it requires, just brave movement from the decision makers and the leadership of the workplace to have and make mental health services available for their employees. We're really proud that Takalam comes, and there are other offerings as well at the market to give the employers the options.
Yeah.
So here in the region, you would find solutions as Takalam, where it is, again, easy for the employers. They can track the progress and see how much of impact has been happening in their workplace. At the same time, it speaks to the community's needs and culture. It is private, and the whole journey is protected for them as employers and their employees. It's really simple action. That is what is required from each and every business decision maker to contact and find out the right solution for their community. And here we are at Takalam, we're really happy to provide, discounted sessions of well-being intro sessions for the employers who are part of this great initiative.
Thank you for sharing that powerful data that you just did a few minutes ago. And with that, my last question to you, Inas. We have a lot of leaders here in the room with us, C-suite executives, so many senior level people. what would be your message to them?
Thank you again for this. I'll just build up on what I have mentioned, that Takalam can be of a great solution, help you, generate a confirmed and a committed return of investment as has been declared globally. Just reach out to us. We are on info@takalam.ae. We're available. We'll be happy to carry on discussions and help you and support you finding ways to make access for mental health services and well-being easy for you and your employees. We understand that businesses and the economy is under a lot of pressure nowadays, many constraints, and this carries on. And that's why it's really important for each employer to build up on the best capacity and performance of their employees that they are onboarded. The only way to make that possible is actually by easing your employees' access to mental health care and services. Us at Takalam, in a way to support that and support these initiatives, we have been in discussions as well going on with insurance companies. And we believe that this should be also part of the insurance, as has been declared also in the news recently. Yes. So we are the first well-being platform of our kind that has a partnership with an insurance company, and we continue to build up on this as we go. Already we've announced one more in the way here in UAE and in Saudi Arabia. And please, for again, the employers, the decision makers, reach out to us. We will help you find the best way and solution for you and your business.
And if I may add my 2 cents, what's of essence is also to walk the talk.
That's so important. That is so important. As you saw me walking in and you asked me, how are you? I said, like, it's been a crazy day, and all what I'm trying to do is really walk the talk. It is not easy. I mean, every one of us is facing a kind of burnout, a lot of stress and so on. The only way to continue being, inspiring and motivational is actually by having access to supporting tools and self-help tools as well. Not necessarily speaking with a counselor. That all and more is available at Takalam.
Thank you so much.
Thank you. That was really fun. Thanks. Thank you.
Thank you.